Hi, sitting in for Josiane is Danny Darrow, and hello, I'm Danny Darrow, and I'd like to welcome you to Josiane's show of Persons of Interest. Today we have a wonderful, wonderful doctor that is double board certified, and he specializes in facial reconstruction, neck reconstruction, post-surgery reconstruction for cancer, for brain surgery, where a lot of the other doctors leave marks and dents and all kinds of facial disfigurements and stuff like that. And he is double board certified, and he is a very dear friend of mine. And here he is, Dr. Kevin Ende. Hi, Kevin.
How you doing, Danny? It's good to see you again.
Yeah, thank you. It's wonderful to see you again. I'm very happy that you're here. And you know, the public thinks that fat transplants. We're getting into fat transplants, and you know, what does the public think about fat transplants? Tell me.
Well, Danny, most of the time, people, public patients, you probably also think that these filler products, both temporary and also fat injections, are just for filling in lines and wrinkles on the face. But really, there's a lot of uses for fat injections. It can be used in reconstruction, cancer surgery, brain surgery defects, any kind of defects or irregularities on the face. We can help correct with fat injections.
Yeah, fine. You want to get into it, and let's get into it, and let's get a little more.
Well, fat injections are really a big part of my practice.
Okay.
Over the past 3 years, actually, I've done over 700 fat transplant patients. So
wow, plus 700 plus.
700 plus.
Okay,
yeah,
okay.
Absolutely. So 2 years ago, I was part of an expert panel on fat injections, and just recently, last week, I actually led that panel on fat injections down in Washington, D.C. So certainly, fat injections are a big part of what I do. You know, you wanted to talk a little bit about different things that you can do with fat injections.
Yeah,
So,
yeah. Because people, I don't think I never even thought about fat in injections. I mean, people just go through life with their scars, with their indents, with everything,
Right.
and you know, they don't even think about it. And they just keep living. But you know, the way you do it, you actually bring more life to the person.
Sure.
You actually make a happier life for them, where they can go through life, you know, looking better, feeling better, and really loving themselves more.
All right. Well, what I want to do, Danny, I'll start out with a picture just to give a good example of what if someone had brain surgery. We showed this picture last time, and it's an area where there's just no hair on the top of the head. A lot of times after surgery to the scalp area, whether it's brain surgery or any kind of surgery there, patient's going to lose hair in that area. So after a hair transplant procedure, after one hair transplant procedure, it's going to look a little bit more like this, where there's going to be hair growing out of it. But that's just hair that's covering the area. There's still irregularities there from the surgery that they had. And just to show you the final picture here after the second hair transplant session, certainly the area is covered up. It's almost like throwing a blanket over it.
Yeah, it looks almost normal. It looks beautiful.
But if you run your hands over the area, if you get really close to this patient, you would notice that there's a little bit of irregularity in the skin surface there.
Yeah.
Just like after any other surgery.
Yeah.
So for this particular area, you could come in and do fat injections to that area to smooth it out and help the contour of that area.
Yeah.
So that's just one example of what you can do with fat injections. Now, you wouldn't do that at the same time that you did the hair transplant, but once your hair starts growing in,
Yeah.
if the person wanted to smooth out that area, you would do the fat injection.
Yeah. All right. Now, how long does fat injections last? Do you have to keep doing them over again?
Well, that's a good question. I mean, fat injections, we're talking about fat transplants.
Yeah,
So
yeah.
it's just like any other transplant surgery. The thing that you transplant shouldn't really go away. When you transplant a kidney, you wouldn't expect it to all of a sudden go away.
That's right. Okay.
Same thing with hair transplants, same thing with fat transplants.
Okay.
So once the fat is put in, it does fill in the area, and anywhere from about 30% to 50% of that fat is going to stay there. We know that some of it goes away, so we over-inject the area so it looks a little puffy for a while. But as some of that fat goes away, the rest of it actually stays and gets a blood supply, and over time it just integrates into the tissues that are already there. Not only does it integrate, but sometimes when it gets that blood supply, the fat can become robust, where it just the fat cells themselves start to enlarge a little bit, so it can fill in the defect better.
Yeah, all right. Now, if a person goes on a diet and loses weight, does he also lose part of the fat in there?
It's a good question. The fat that you put into the face acts like it would anywhere else on the body. So if you're losing fat in your abdomen, or if you're on a diet and you're losing fat all over your body, the facial fat's going to act the same way.
The same way. Okay, but now, after surgery, when there's scars and stuff like that, when you inject the fat, can you cover up the scars? Can you, because there's a lot of shadows on people's faces,
Sure.
and one side of the face looks different than the other side of the face, and when I look at somebody's face, I don't really know what I'm really looking at.
Sure.
And I'm saying, gee, I'm just taking them for granted because maybe that's the way they were born.
Sure.
What do you do with things like that?
Well, there's a lot of different things we can talk about for that. Let's just take, for example, someone who's had surgery on one side of their face. Let's say it was for a skin cancer or really anything that they had surgery for. There's a lot of great surgeons out there. They may even have a beautiful fine line scar that you can barely see. But when you look at them, something is just drawing your attention to that area.
Yeah, right.
You may not really realize what it is because you look closely at it and you see that nice fine line scar.
Yeah.
But something is off. And really what it is the shadow patterns. It's the way that the light is hitting that area.
Okay.
And there's a contour difference now because once someone has had surgery in that area, the shape of that area usually doesn't stay the same. So when you compare one side of the face to the other, you can see the difference there. So when you have, let's say, an area after surgery that's flattened out compared to the other side, let's say it's on the cheek area, if you add fat to that area, you'll give a better contour to it, and you try to shape it like the other side.
All right. Can you make one side look exactly like the other side?
That's a tricky thing. I mean, it's sort of like, I think of myself as a sculptor.
Okay.
Here, and
All right.
it's not like it's clay, because when you sculpt clay, that's just how it's going to stay. With fat injections, it's a little bit different because we're using the fat injections to sculpt the area and reshape it and try to get it to look more like the other side. But we also have to anticipate the fat that's going to change, because as I said, not all of that fat's going to stay there.
Okay.
So not only do we have to actually sculpt it, we have to anticipate what it's going to look like afterwards. And the answer to your question is no, we can never really get it to look exactly the same as the other side, but we can get it a lot closer than it is now.
Yeah.
On most patients, and most people are very happy with the amount of improvement that you can get.
Yeah.
It's all about improvement with these kinds
Okay,
of
fine.
surgeries.
Now, let me ask you another thing. I asked you if when the patient loses weight, does it change? How about if the patient gains a lot of weight, does the fat double up on the inside or something? It's going to show that it's different from the other side?
Well, that's a good question as well. When you add fat to one side of the face, you're trying to build that side up. But if the person gains weight overall, let's say they gain 50 pounds, they're going to gain fat size on both sides of their face.
Right.
Not only the transplanted fat, but the fat that they already had on the other side.
Right.
So typically, it grows at the same rate. It's really no different.
So it'll be even. It'll
It should
tend to
still
be even.
Yeah.
All right. Now.
I've never seen it be otherwise.
All right. Okay.
We try not to let our patients gain 50 to 100 pounds, but
Yeah. All right. All right. Now, where does this fat come from? What kind of fat do you use? I mean, is it fat that you take out of somebody else's body? How do you get it?
Well, people don't mind donating fat. I mean, they're taking it from an area of their body that they don't want it and putting it into a different area.
I see.
So, for instance, when we do a facelift procedure, we do remove fat on the face because we want to remove the fat that's under the chin area sometimes here along the jawline. But that fat really isn't good. It doesn't really have a lot of stem cells. So even though it'd be really easy to use that fat because we're throwing it away anyway, usually we use the body fat because of the stem cells. So the most common area that I'm going to get it from is the abdomen.
Okay.
And it's done without making any cuts or stitches.
Really? Well, how do you do it? Tell me.
It's all done with a really small liposuction cannula.
Yeah.
But we don't use a high-powered suction device because we don't want to damage the fat. This isn't just removing fat. We actually have to use this fat.
Yeah.
We want it to stay alive, just like a transplant.
Yeah.
So it's all done by hand.
Yeah.
Through a very tiny incision that doesn't even require stitches to close it.
Yeah.
And the fat is removed either from the abdomen or the love handles or really wherever the person has it. It could be from the thigh area. We could take it from the knees. Most people don't want fat removed from the buttocks, but it is good fat. It can be used.
Yeah, yeah.
And there's a few other areas you can take it from, sort of the back and wherever the patient has it.
Wow.
So there's a lot of different areas.
Yeah.
You know, a lot of people want to know if they can donate fat to someone else, and it's just like we talked about last time with transplant surgery.
Okay.
When you're going to donate kidneys or livers, you have to make sure you're a match, and then the person that you give your kidney or your liver to has to be on medication lifelong.
Yeah.
So with fat transplants, since it's more of a cosmetic thing, most people don't want to be on medications the rest of your life. And I know you're a generous guy, and you might want to donate some, but...
well, I don't know. I'm going to think about that, Kevin. You know, I mean, you know, I need all the fat I can get, especially at my age. It's got to keep me going. In the wintertime, got to keep me warm. I've seen people with hanging lips, and all kinds of stuff like that, and you know, different hanging eyes, hanging lips, hanging this, hanging that. How do you reconstruct the lip areas or the eye areas? You know, for that part of the face.
Sure. Lips is certainly an area I know a lot about. I've written a book chapter about.
Oh yeah, you did. That's
and,
right.
And lip reconstruction and things like that.
Yeah.
Which your audience can definitely find.
Yeah, where can they find that?
You can do it through my website. It's on drende.com, and if you go on the lip section, you can get a link to where the book is actually, and you find the chapter on lip surgeries.
Okay.
But lip surgery is also a very big part of my practice, and that also sort of relates back to the fat injections.
Yeah.
You know, just as an example, a story, one of my favorite stories about lips. I had a patient come in after his wife actually caught him cheating.
Really?
And went to give him a kiss, but instead actually bit off a section of his upper lip.
Well, thank God it was only his lip, because there's other sections that she could have bitten off.
That's true. It's a visible area, but you're right. There might be some other areas.
Yes, that's right.
More functional.
Yeah, and then how do you replace those other areas?
You send him to another doctor for that.
Okay, all right, okay.
It's on the face, that would be for me.
Okay, all right, so go back to the lips.
So, you know, if a patient goes to the emergency room that has that type of injury, the emergency room is going to do a great job of sewing things up, getting it back together. But if there's a piece missing, then there's an issue there.
All right.
So there's a lot of different techniques that can be done to reconstruct lips. And I know we have a limited amount of time, so I just wanted to mention about fat injections. You know, if you have a piece of lip actually missing there,
Yeah.
and you go ahead and do these fat transplants to that area, you can actually build it up to make it look more like the other side. So I have a couple examples.
Yeah, let's see him. I want to see him. I want to see him.
I don't have permission to show the picture of this patient that had his lip bitten off.
Oh, okay. All right.
You
Okay.
can see some other examples here.
Okay.
On the bottom, we have, if we can just zoom in on this particular picture so we can see here.
Yeah. Yeah.
Let me hold it up here. So on the bottom, you can see, especially in the upper lip area, how thin the lip is.
Yeah.
There. And this is the kind of thing that happens with age. Your lip just gets smaller, starts to hang, and part of the red lip just kind of turns in.
Yeah. But was that the before or after?
This is all before on the bottom.
Okay.
And this is more of a cosmetic thing, but just as an example
Oh,
of
all
what
right,
can
okay.
be done with fat.
All right.
When we compare the one on the bottom here to the one on the top, this is the same person.
Wow.
With fat injections.
It almost looks like your lips, Kevin.
Thanks.
Go ahead. I'm sorry. Go ahead.
So with fat injections and with other reconstructive techniques, you can actually build the lip back up to look more full. And if this was, let's say, just on one side, like the gentleman I mentioned with the defect,
Okay.
I could use the fat injections and maybe a lifting technique to build that back up and make it look more full, just like this patient went here from the bottom picture
Yeah.
to the after picture on the top here.
Now, building up the lips and changing the lips, does that have anything to do with reconstructing any of the other facial parts?
Sure. Well, just as another example of the lip here, this is another patient here. Same thing with filling in the fat. Now, people with this is obviously the before picture on top here on the top lip, and then using fat injections to build it up. And not everybody wants a big lip, so
Okay.
it's a subtle change, but this is what the patient wanted. But when you have lip defects, I think what you're asking about is what can sort of happen as a problem if you're missing a piece of your lip. And think about your saliva. The saliva.
Yeah, yeah.
If you're missing a piece of your lip or a function of the muscle there, you can have saliva that just sort of spills over the edge.
It just drools, because sometimes when I'm
Exactly.
sleeping, I'm drooling too. But I got both my lips so far, I think.
You don't need me for that.
Okay, all right, okay.
But
Well, how do you prevent the drooling?
well, if someone comes in that's missing part of their lip and they have drooling there, there are different surgical techniques that can be done to reconstruct whatever is missing there. So part of that is lifting maybe a flap from inside the mouth to cover that area up, and then using fat injections to build up the size of that lip.
Yeah.
Because as you build up the size of the lip, there's maybe less chance that that saliva is going to spill over the edge when it's small. So
Yeah.
there's a lot of different techniques, but fat injections definitely play a role
Okay.
in building up lips
All right.
for people with that
All
problem.
right. Now, as far as building up the lips, what happens with the gums and the teeth and the other parts around the lips? Does that affect anything else?
Sure. Well, there's muscles that are in that area. There's a lot of different muscles that open and close the mouth, muscles that lift up the lips, in the corners of the mouth. There's a lot of different muscles doing a lot of different things there. So it depends really on what's damaged and what needs to be fixed. In terms of the drooling, there's a muscle that circles the mouth, called the orbicularis. So if there's any disruption of that muscle, that also has to be repaired with a reconstructive technique to prevent the drooling.
Yeah. Wow, that's really something. What else do we have as far as cancer surgery?
Sure.
Let's go back to cancer surgery. Let's go back to brain surgery, where they have indents, where they have. How do you repair those things?
Sure. Well, just as an example, you have glands that are underneath here. That's called the submandibular gland. You have one on each side, one over here, one over here. A lot of patients have stones in those glands. So eventually it may come to a time where either they had cancer there or they have stones there, and the submandibular gland has to be removed. Surgeons that do this surgery are great. They leave usually a nice fine line scar there, but the person's now missing their gland. So,
Oh, really? Oh,
so there's
wow.
nothing that's put back in there usually. So
yeah.
you have this indentation or a concavity in that area. And when you look at it, again, it's one of those situations where you see this nice fine line, it looks pretty good, but you don't really realize what the difference is between the two sides. And it's the shadow patterns that are created by that concavity in that area. So if you use fat injections to build that area back up, you can try to smooth it out and give it the same sort of characteristics as the other side. And then there's still that fine line scar there, but you don't notice it as much because there's less of a shadow.
Less of a shadow. And you do that with the fat injections also?
You can do that with the fat injections.
And everything else. But does the scar go away after a while? Or what happens with that scar?
Scars typically do fade over time.
Yeah.
There are different things that you can do for scars, like scar creams. Most of the scar creams that are used now have silicone in them, and over time they basically help the fibroblasts to reorganize and to flatten out the scar tissue. If that doesn't work, you can use lasers, and lasers help to basically smooth out the surface of a scar. You can never really eliminate a scar 100%, but there's a lot of things like lasers, like I just mentioned, that sort of disguise them a lot. And then beyond that, of course, there's makeup.
The makeup,
Makeup goes a long way if it's a very fine line scar.
Yeah, but I think people that have surgery and stuff like that to cover up, they could save a fortune of money by not buying makeup.
Sure, and again, it's really not that line that's the problem. It's the irregularity in the area. The line may be something that you notice, but the concavity or the irregularity is something that you really have to compare one side to the other before you realize what's going on. And the human eye really can't do that fast.
All right, now, I've got a tricky one for you.
Oh, boy.
Okay, now, I see people, that have their necks hanging and their double chins and with wrinkles all over their necks and stuff like that. How do you repair those things?
Sure. Well, I actually have an example. Why don't we just take a look at this patient. This patient here has a lot of different issues going on.
Okay.
You were mentioning the neck, so this is a good one for that. Let me hold that up so we can see the neck area. The neck can hang down for a lot of different reasons. It can hang down for aging, it can hang down from trauma, it can even hang down post-surgery if something was removed and a lot of extra skin was left there. So, a patient like this, just point out some of the issues that we have here. We have a hanging neck with the muscles that are hanging down here. And then we have a lot of hanging skin right along the jawline here with some wrinkles in here. And we have this wrinkle that comes basically from the corner of the mouth, and it just comes up basically right here to the nose. It's called the nasolabial fold here. We have underneath the eyes, we've got some bags under the eyes. And you know, to basically take care of someone like this, with the neck area, we would need to do a neck lift. But up here, it's more than just lifting up the skin on the jawline. Certainly that's going to help, but there's a lot of volume loss here. We have a deep fold right here from the nose, and we have all these different wrinkles in here. So just pulling the skin isn't going to help this person. So just to show you what I did for her and just to explain it.
Okay.
For this particular patient, you can see, first of all, that the line down here is almost completely eliminated. And it's not just from pulling it. This is also with fat injections. So yes, she did have a facelift, but putting in fat injections really helps these contour regularities. Also coming up from here to here, you can see that the nasolabial fold is a lot different than it was before. And you remember all those little wrinkles that were over in this area, those are all eliminated. And again, it's not just from pulling it, it's also from fat injections. And I have a good example of her from a different angle here. Let me get that out for us.
Yeah.
Just to show you what it can do under the eyes, because I know you were asking before about what we can do for the eyes. So if you look under the eyes here, you see the bags under the eyes. But if you go ahead and you just remove those bags, they're going to look hollow under there. They're almost going to look very ghostly if she was missing that. Really what you want to do is go ahead and remove those bags from the area that they are, but also fill in this wrinkle that's underneath there, just to smooth out the area. So if we go to the after picture here, looks like there's a shadow there, but the underneath the eyes, that bag is gone, and that line underneath it is also eliminated. So that's from removing the bag and also from smoothing out with fat injections.
Yeah, it looks great.
So you can use fat injections in a lot of areas on the face to fill in lines right here. Also marionette lines down in this area. And if you remember, this patient also had a lot of wrinkles on the side in the cheek area. So those are all filled in now with the fat injections.
Wow.
In her, it got better over time, actually. These pictures are a year after having the surgery.
Yeah. Wow, it's wonderful. People, do they have trauma when they do this, as far as psychological effects, mentally?
Absolutely. There's a whole psychology that goes into these kind of things. I mean, it can be as bad as post-traumatic stress disorder. You relate a scar or an injury to a trauma that you had, and you can never really live it down. Wartime things. And really any kind of significant emotional event in your life can lead to these kind of things. So just like a tattoo that reminds you of a time in the past that maybe you don't really want to think about.
Yeah.
Same thing with a scar. It's going to remind you of an event, maybe a cancer or something else that you just don't want to really think about. So when you treat these things, you're not necessarily getting rid of that traumatic event in somebody's life. You really can't do that. But if there's not this constant reminder that they're wearing on their face, then that may help them emotionally and psychologically.
Yeah.
So by doing these reconstructions, filling in the fat injections, I'm doing more than just surgery. I'm helping them emotionally as well.
Absolutely right. I'm sure they're living a happier life, a normal life, a more positive life, where they feel good about themselves, they love themselves, and it's really wonderful.
Sure.
It's really wonderful what you're doing.
It's a good feeling for me as well to see them afterwards, the results, and then also talk to them and find out how they're doing.
Sure, wonderful. What else can you tell us about if they break a bone?
Well, when you let's say you broke a bone in your forehead.
Yeah.
That's a common area, maybe from a car accident or really from getting punched or really anything.
Yeah.
You'll go to get that reconstructed a lot of times. They'll use a bone plate in order to do it.
Yeah.
But you'll have a scar there if you had a laceration in the area. There may even be a bony irregularity there. Maybe the bone doesn't heal right afterwards.
That's right, yeah.
So that's sort of where I come in for a lot of these things. So
But that's all post. That's all post.
This is all post.
Yeah. Okay.
This is not at the time of the event, but when it heals up months later.
Yeah.
And if it doesn't look right, then
Then you
that's when
come
we
in
start
and you
thinking
make it
about
look wonderful.
So if the person comes to me, we can talk about different things. So if there's like a bony defect, before we had fat injections, what we used to use was silicone implants.
Yeah. But how long does the silicone last? It doesn't last too long, does
Well,
it?
there's different kinds of silicone. There's liquid silicone that really gets a bad name. You think about breast implants where the silicone leaked out and people had problems with that.
Oh, that's right.
Yeah.
That's right.
So there's a lot of bad publicity about silicone. However, when we're talking about implants in the face, we're talking about a polymer of silicone called silastic,
Yeah.
which is a hard plastic material. It's not a liquid.
Yeah, but is that as dangerous as the silicone that they put in for breast implants?
It's not, because it's a solid piece, so it can't really leak and it can't really go anywhere, and it's inert, chemically inert, so the body doesn't really react to it. It just forms a little capsule around it, and typically if you go back in and take that out even years later, it looks exactly the same.
Oh, wow.
So we used to use that a lot because you can take these silicone implants and they're pre-shaped for certain areas, such as like a chin implant or a cheek implant, or you could just take a silicone block and actually carve it. That's where the sculpting comes in again.
Oh,
You just
really?
Sort of sculpt that silicone block down to the defect so it can look nice and smooth. But when you think about it, you still have a foreign body in you. You still have this piece of plastic that's inside of you, and maybe you don't want that.
That's
maybe
right.
You'd rather have your own fat
Right.
in your own body. You can't be allergic to it. You can't have really any problems. There's no type of reaction you can have from something that came from your own body. So a lot of patients would rather have the fat injections to reconstruct these defects. So if you have bone trauma and it's fixed and you have a defect there, you can do fat injections to basically reshape that area. I have an example that we kind of had last time here.
Yeah, let me see it again.
Let's say this patient here had a scar right up in here along the hairline. We could do the fat injections there to make sure the contour was okay, but you'd still have that scar, and that's also a problem to see that scar line. So what about just bringing her hairline down to cover up that area? We have a procedure that I wrote the original paper on called the hairline lowering procedure,
Okay.
which can bring the hairline down to not only cover that area, but you can also do the fat injections at the same time in order to get that area looking more smooth afterwards. So just as an example of what she would look like after a hairline lowering procedure, you really don't see any type of scarring in that area. And the hairline can be brought down up to about 2.5 centimeters in every patient. 2.5 centimeters is approximately an inch.
Yeah.
So we can definitely do that. And that's a very common area that's injured, right along the hairline. This is another good example. I'll show you here before pictures of what you can do around the eyes with fat injections here. She had these pretty big bags under the eyes on both sides. And the cheeks are really depressed. As we get older, or from trauma, or from cancer, anything, the cheeks can get smaller. So when you use fat injections, I could show you her pictures here again after.
Yeah.
You can actually build up the cheek area with fat injections.
That's beautiful.
On one side or the other. And then again, under the eyes. You take the fat out from under the eyes, but you also put in fat injections to smooth out the area because you don't want to hollow that out.
And you almost made her look like a movie star.
Yeah, so I like the way she looks. She likes it too.
She looks great. But how long does this last now?
Well, with the fat injections and pulling and things like that, that patient didn't have a facelift.
She did not.
That's all done with fat injections and hairline lowering procedure.
All right.
So over time, the skin changes, the muscles change, and things start to sag, whether it's from having had cancer or just from time, basically, or bad genetics.
I know, because when I get older, everything starts sagging on me.
Oh, there you go.
There you go. Okay.
So if we go ahead and pull that back up, you're going to have it's going to look a lot more youthful. And so how long does it last? It's different in everybody.
Yeah.
Typically, when you're pulling things back up, these are things that someone needs to do every 7 to 10 years.
Yeah. All right.
But it's variable. And with fat injections, you can always do more.
Yeah.
It's such an atraumatic procedure. There's no cuts. There's no stitches.
Yeah.
There's usually not even much bruising with it.
Oh, really?